facility in June of 2009, we applied for some federal stimulus money, and we were able to, with Congressman Doggett's help, achieve about $240,000, which we put with some other funds to build this and renovate this pediatric wing. We now are able to see brand new 6 new patient wings. We have added 2 new providers. We believe that we'll be able to see 2,500 children here in this facility specifically each year. And that is a tremendous benefit touching many, many, many lives. We're very, very thankful for your help. Without further ado, Congressman Doggett, back in 1991, you signed my law license. and I've forever been grateful. Seriously, Congressman Doggett is a huge supporter of community health systems, both in Texas and nationally. He has been a big supporter of federal stimulus legislation. It has directly helped this organization create this state-of-the-art pediatrics facility. His work is touching the ground here today. And so, on behalf of, we have a couple of awards. That's what I'm supposed to do. It's my job today. And I would like, first of all, on behalf of Community Care, and specifically on behalf of the National Association of Community Health Centers, we are honored to present Congressman Doggett with the 2010 Distinguished Community Health Superhero Award. That's not all. In addition, on behalf of the Texas Association of Community Health Centers, they would like to present you with the Big Heart Award for all of your
Thank you so much. This will really have a place of honor in my office. I feel like I am getting away with everything here as superhero, but it came to impress my grandchildren. I am here like you are because I believe in the mission of this clinic. We talk about numbers. We took so much negativism over the whole economic recovery package. It translated into great benefit for our community. We see some of it right here. We talk about the numbers in terms of the ups and downs of the budget for community health, but it's really all about the young people who will come to this clinic, the seniors who we just saw leaving this part of the clinic, and the quality of their life. I believe that these are dollars that are very well spent. I salute the local involvement, the board members who work here, the administration, and all of the various advisory committees that work with our community health centers to be sure they are sensitive to the needs of the community. This center I have worked with in the past. We've got some funds out here to assist in the equipment and improvement of the center a couple of years ago, and these funds just allow the expansion of the mission. We have big challenges up in Washington right now. As those of you who are most involved with community health care know, last week the House approved cutting over $1 billion in support for community health centers across the country. This means that 120 some odd around the country would just be shut down. One of them is just down the road in San Marcos, a relatively new clinic that the doors will shut off, and there will not be the kind of services that are being provided here. In fact, their services are more limited there already, and it means that services will be reduced at over 1,000 healthcare clinics across the country. This is denying the opportunity to be well, certainly with pediatrics, to these children, so that before they can learn, they have to have the health or condition to be able to learn in our neighborhood schools. It's directly related to the opportunities they will have the rest of their lives if they're able to go to school well, and if their family is able to go to work because they're not up all night with a sick child. So this is really making a difference in the lives and the future of our community and of our state. And I think these proposed cuts to community health would be a disastrous move backward to a path that we just cannot accept. I'm hopeful that in the next few weeks, we're actually just a week from Friday before this funding in the current budget comes to a halt. So we're very near that point, that with the involvement from people who care about healthcare all over the country, we will be able to reverse that cut and see much more modest changes in the budget that will become effective a week from Friday. But it's a continuing struggle that we face there. And we will only change this attitude about community care if we engage more of our neighbors who may not be coming here to get their health care, but they have a direct stake. I salute the leadership of community care, not only for what it has done in terms of health care for those who are served, but what it is doing to educate people in the Travis County, Austin area about how much we have at stake in seeing the system work. And that's what we need all over the country with reference to these cutbacks, to engage people. The employer will never come here, but may not have people as a reliable workforce if they can't get their health care services or if they have a member of their family who's ill. There is not only the concern that we should all have for our neighbors who are the most vulnerable, but there's a direct economic stake that people of all political philosophies have in what happens here and in making it work. So I hope we can pull together to reject the cutbacks and continue to have happy gatherings as we have here today, where we're opening more opportunities so that more of our neighbors can be assured of the kind of quality health care that you're providing here. I salute you, I thank you, and I pledge to be your continued partner in working to make a difference. Thank you.